Yes,
Is
David.
it ineffective tissue perfusion? Because it's cyanotic.
You could probably do that. Is that
I think
one?
confusion would not be.
Yeah, we're not there yet. Yeah, let's keep working. These are just the three talking about respiration. Yes, Marianne?
Can you repeat?
Repeat it. Yes, I can. Impaired gas exchange related to pneumonia, pleural effusion, and COPD as evidenced by hypoxemia and respiratory acidosis, a pulse oximetry of 85% on room air. What is the percent of oxygen in room air? 21%. Okay? At sea level.
Where are we getting the pleural effusion from?
Diagnosis from the first page.
Actually, it's not an
Chest
X-ray.
X-ray.
Chest x-ray.
Oh, I see. I didn't know.
So now let's move on to activity and tolerance. That's another one, right? Related to what? Let's not call it shortness of breath. Activity and tolerance related to, let's call it something else. Impaired respiratory function. As evidenced by the inability to complete a short sentence. Okay? Before respiratory status does what? Declines. Okay? Just talking causes, declination causes his respiratory status to decline. He's not tolerating much activity, is he? He can't even talk. Beg your pardon? Fatigue, yes, exactly. Activity and tolerance related to impaired respiratory function as evidenced by hypoxemia, as evidenced by inability to complete a short sentence without a change in his respiratory status, without a decline. So let's talk about another one. Give me another nursing diagnosis based on this gentleman, based on Harry's, what's his name? I can't remember his name. Menopause, Harry Smith. Anxiety is one. But before, is he anxious? Do we know he's anxious? He's got something else going on right now.
Mental status.
Well, it's your mental status, which we're going to call, what's the C word?
Confusion.
Confusion. Is this confusion chronic?
No. Not according to his family.
What is it? It's not chronic, it's acute. Acute confusion.
Well, couldn't you say risk of injury?
It's not a risk. We still
Well,
have
if
regular
he doesn't
diagnosis.
know where he is, he may get up and walk around.
We're not doing the risk things yet. Risks, we're doing the actual diagnoses. He's, he is at risk for that down the road, but we're looking at actual diagnoses right now.
Okay.
Okay? He has acute confusion. Okay? Related to what? Hypoxemia. Okay? Not getting any oxygen. Manifested by disorientation to place and time. So he's only oriented times one. Doesn't know what day it is, doesn't know where he is. Driving down the road, knows who he is, knows he's Harry Smith. But that's all. Now we get to the risks. So these are the 4, 1, 2, 3, 4, 5 actual diagnoses. Okay, ineffective airway clearance, ineffective breathing pattern, impaired gas exchange, acute activity intolerance, and acute confusion. Now thinking about those things, someone who can't tolerate your activity, someone who's confused, someone who's not oxygenated, puts them at risk for other nursing diagnoses, other problems, okay, to add to the nursing diagnoses. So what is he at risk for now?
Injury.
Janice?
Injury.
Injury related to, as evidenced by whatever? Say it.
And for confusion.
Risk for injury.
I would even say for fall too.
Well, he's at risk
injury
for fall, but
related
let's
to
just-
confusion and shortness of breath.
So let's just go-
Fatigue, so he'd be a fall.
So he's
risk
he's
for
at
sure.
risk for injury
Mhm.
from falls as evidenced by
Confusion, shortness of breath, fatigue.
many things, right, okay?
There's not as evidence for risk for
No, there's not evidence for risk for, but he's risk for fall due to,
related to.
related to, or due to, related to, yeah. No, I'm probably better at this than I am. Okay, let's talk about something else he's at risk for. Yes,
Series that have for a electrolyte imbalance because of sweating.
or fluid volume, right, yes, fluid volume, right, related to fever, diaphoresis, fever, and tachypnea. Fluid, risk for deficient fluid volume, or fluid volume deficit, either way. That's the same thing to me.
I don't know if this is nursing diagnosis, but since he's diabetic, he's gonna be at risk for getting messed up blood sugar.
Nutrition, yeah, yes, for sure, we got that. Mary,
He already has the pneumonia, but could he be at risk for other infections, secondary infections?
sure, absolutely, he's already diabetic, he's at risk for that anyway.
So he
He's
could-
70 years old, right.
So we could put,
Mhm.
would it be secondary infections or just risk for infections?
I might put risk for secondary infections, but that one doesn't hit me as some of the others, okay? Let's go over a couple more first. Melissa was hitting on it with imbalanced nutrition, okay?
Fluid volume deficit.
What about patients who have COPD that you don't know yet?
Oh,
Just the work of breathing, they don't have much appetite, okay? So he's at risk for nutrition more or less than body requirements. Less than body requirements. Related to, what happens when you're breathing? Do you keep swallowing?
yeah.
You shouldn't.
Can I swallow my tea while I'm breathing like this? Because what will I do? Aspirate. So it takes a lot of work to breathe that fast. And if I have to take that amount of time to breathe, and how many breaths per minute on average? 14 to 16 is average, and he's breathing what, 30? What did we say? 28? Okay, how much time is there in that minute to eat and swallow, to chew and swallow? So, so he doesn't really have the energy, and he can't stop breathing long enough to eat. So he's at great risk for nutrition imbalance. Okie dokie. Potential complication. What can happen to him?
Infections from swallowing.
Can have infections, but what else can happen from just his diagnosis as it is? What is a potential complication?
Respiratory failure.
Respiratory failure. Respiratory failure. And another potential complication from a fulminating infection? Shock. Sepsis and shock, absolutely. Okay?
When you have like sepsis or shock, like there
Sepsis
is,
and
I
shock.
don't think there's a nursing diagnosis risk for sepsis, is it just
For
a risk of
potential.
infection
You
sepsis?
could actual potential.
You would put potential complication, I would say sepsis. I guess? No, Katie?
I don't know.
That's okay, no, you're doing well over there.
It's just actual or potential
It's
infection.
actually
or-
potential, it's a potential. The nursing diagnosis can be potential. So what are our goals? What do we want to do for this gentleman? Right. We want to improve his airway patency. First of all, we got to make sure that he's doing what with those secretions? He's clearing them out, right, because we want to help him resolve that atelectasis, right? Remember, atelectasis is no movement of air. He's got all that consolidation, so we want to improve the airway patency, the whole airway, not just the upper, whole thing, all the bronchioles open up, all the alveoli open up that he's got left that aren't all misshapen from the emphysema. We want to improve his breathing pattern, right? Don't we? Because ultimately, why do we want to improve his breathing pattern? What's our goal? What are we trying to improve? Gas exchange, right. Gas exchange. And that's the purpose, right? Cells can't do anything without oxygen. We need oxygen to drive ATP.